Then comes the streptococcal, enterococcal infections. Streptococcal infections and enterococcal infections. Now what are streptococci? The streptococci, the epidemiology of the streptococci, group A streptococci. Then clinical manifestations of the streptococcal infection, the pharyngitis, the scarlet fever, the skin and soft tissue infection, then pharyngitis, impetigo, erysipelas due to streptococcal infection, then necrotizing fasciitis, pneumonia, empyema, streptococcal toxic shock syndrome. There in staphylococcus also one toxic shock syndrome. Here also one another toxic shock syndrome, that is the streptococcal toxic shock syndrome. Then the drug of choice for the treatment of pharyngitis, the drug of choice for treatment of impetigo, drug of choice for treatment of erysipelas, the drug of choice for necrotizing fasciitis. Then coming to the impetigo, in detail about the impetigo, how it occurs, all these things, cellulitis, streptococcal cellulitis, then pneumonia and empyema, then bacteremia, blood culture, then toxic shock syndrome, then the case definition of the streptococcal toxic shock syndrome. What happens in the how will you define the streptococcal toxic shock syndrome? Then streptococci of group C and group G. Streptococci of group C and group G. Then group B streptococcus, very important is the group B streptococcus. Then neonatal infection. In neonatal infection also early onset infection which organism causes, and late onset infection which causes, and the definition of early onset as well as the late onset. Early onset means within the first week of life, and late onset means when it develops when the infant is neonate is more than 1 week old, and generally less than 3 months. That is the late onset infection. Then group B streptococcal infection in neonates. Then the infections in adults. Then a non-enterococcal group D streptococci. This is very important. Non-enterococcal group D streptococci. Then viridians streptococci. Then abiotrophia and Granulocatala species, nutritionally variant. These are called nutritionally variant streptococci. This is very important. Nowadays they are asking about abiotrophica and Granulocatala, that is species, nutritionally variant streptococci. Then enterococci, the microbiology of the enterococci, the epidemiology and the clinical manifestation of the enterococcal infections. Then cornybacterium and diphtheриal infection, very important. They will ask about a membrane and they will say which is this and what is the difference between the other membranes, what is the differential diagnosis. So MCQ can be set on the basis of the diphtheria. Diphtheria is a very important topic, cornybacterium and related infections. Then coming to the vaccine that is given in diphtheria. So what are the other related species of cornybacterium? Other related species are Cornybacterium ulcerans, then Cornybacterium gecium, Cornybacterium urealecticum, then Rhodococcus species, then Arcanobacterium hemolyticum. This Arcanobacterium hemolyticum causes the pharyngitis and chronic skin ulcers, often in association with a rash. So Arcanobacterium hemolyticum has been asked repeatedly. Then comes the meningococcal and listerial infection. Listerial infection is very important. Then meningococcal infection. In the meningococcal infection, the epidemiology, the pathogenesis, and the clinical manifestation of meningococci, the treatment of meningococcal infections, the different types of meningococcal infections. Then listerial infection, the epidemiology, the clinical manifestation, listeria, bacteremia, listeria monocytis, meningitis, which occurs usually in the adults. The case fatality rate is quite high in listeria meningitis. It is about 15 to 26%. Then meningoencephalitis and focal CNS infection in listeria infection. Then the treatment of listeria infection, which drug you give. Then comes the infection caused by Haemophilus and Bordetella. This is the most omitted topic by the students, but this topic is most often asked in the PG entrance or the next exam. Haemophilus and Bordetella infection, Haemophilus influenza, epidemiology, pathogenesis, clinical manifestation, then that prevention, and then pertussis they can ask. Pertussis, any MCQ can be expected from the pertussis. Then Moraxella catarrhalis infection, the treatment. Then Hasek group means they are the fastidious, slow growing gram-negative bacteria, this Hasek group. So they are Haemophilus, then Aggregatibacter. Formerly this A was called Actinobacillus, now they are called Aggregatibacter. Then Actinomyces Myceta commitans, then Agaricobacter. Now coming to the clinical manifestation of the HACCP organisms, what the different infections they cause. Then comes the HACCP group of infection, the treatment, what type of treatment is given for HACCP group of organism, which drug is used in treatment of. Then comes the HACCP group of organism, Moraxella and the HACCP group of organism. Then comes the gram-negative bacteria, gram-negative enteric bacteria, and now thereafter comes the Pseudomonas. So the important extra-intestinal pathogenic, enteropathogenic E. coli, enterotoxigenic E. coli, enteroinvasive E. coli, all these things have been repeatedly asked. The Shiga toxin producing E. coli, STEC, then enteroinvasive E. coli, enteropathogenic E. coli, enterotoxigenic E. coli, then traveler's diarrhea, then enteroaggregative and diffusely adherent E. coli, EAEC. These can be asked. Then the intestinal infection which are caused by the E. coli. Then urinary tract infection caused by E. coli. Then pneumonia, abdominal infection caused by the E. coli. Then Klebsiella infection, very dangerous organism. Klebsiella is Klebsiella. Then Proteus infections. Then the most dangerous is the Pseudomonas infection. Then the infection which are caused by the miscellaneous organisms. Then comes the gram-negative bacilli. Anaerobic infections. Now what are the different anaerobic? They are the most dangerous infections. The tetanus, Clostridium tetani. What are the vaccine that is given in tetanus infection to prevent the tetanus infection? Then the treatment, then post-exposure prophylaxis, all those things. Then botulism, botulism, that is also important anaerobic infection. What is the treatment of botulism? Then other clostridial infections, then other clostridial infections, the treatment of other clostridial infections. Then mixed anaerobic infections, then mixed anaerobic infections. Then what is the treatment that is given in mixed anaerobic infections? Then nocardiosis, actinomycosis, and Whipple's disease. Nocardiosis is very, very important. Nocardiosis, the pathogenesis, the clinical manifestation, the diagnosis, the treatment of nocardiosis. Then actinomycosis. In actinomycosis, the microbiology, epidemiology, pathogenesis. Then the clinical manifestation of the actinomycosis. Then the different types of actinomycosis, that is oral cervicofacial disease, thoracic disease, abdominal disease, pelvic disease of actinomycosis. Then the treatment of actinomycosis, very important. If you know the treatment, you can save the life of the patient. So that's why this is asked in the entrance examination. Then Whipple's disease, the microbiology of the Whipple's disease, the diagnosis, the clinical manifestation of the Whipple's disease. Then comes the most important, the tuberculosis, which can be asked in the PSM, which can be asked in the microbiology, which can be asked in the medicine, and which can be asked in the orthopedics. In every subject, tuberculosis can be asked. Genital tuberculosis, all those different types of tuberculosis, pelvic inflammatory diseases, then mycobacterial infections, other mycobacterial infections, then NTM, non-tubercular mycobacterial infections. So the tuberculosis, the epidemiology, pathogenesis, the pulmonary TB, this disease is very important. Then extra pulmonary TB, then drug resistance TB, MDR TB, XDR TB, all these can be asked. HIV associated TB, what happens in HIV? Then the drugs in tuberculosis, in pharmacology, the drugs, anti-tubercular drugs which are given, the regimes, different regimes used for tuberculosis. Then the Mantoux test is repeatedly asked. Then leprosy. Then comes the Lyme's disease. Leprosy is also very important. The treatment of leprosy, the different drugs which are used in the treatment of leprosy, then the regimes which are used in the treatment, the total duration of treatment, then the infection with the non-tuberculous mycobacteria infection. Then comes the Lyme's disease. Lyme's disease means Borrelia recurrentis, Borrelia burgdorferi. So Lyme's disease, what is the treatment of Lyme's disease? Doxycycline is given. Then comes the leptospirosis. Then the spirochetal infections, which include then the leptospirosis, all those things. Then